We've all seen the headlines over the past few months describing the situation that exists inside of our hospitals and our nursing homes. Those headlines have read crisis, crushed, breaking point, 2 nurses for 36 patients, slammed. And like I said, these are just some of the headlines that are out there. But despite the concerns we continue to hear from hospitals and nursing home administrators, from nurses and staff, and even from our county governments about the crushing impacts of these mandates, the state, what do? They issue yet another mandate requiring healthcare workers to now be boosted. Another mandate that could further impact staffing in our healthcare facilities and jeopardize their ability to safely care for the people of all of our communities. Mandates have put roughly 34,000 people, 34,000 healthcare professionals out of work. Ordered every single hospital in my district, every single one, in 40 hospitals across this entire state to pause elective surgeries. The mandates have forced my constituents, forced all of our constituents to travel hundreds of miles from their home for the care that they need. Yes, the vaccine mandates are just one factor. We all know the staffing crisis existed long before the pandemic. And you know what? It's going to exist long after this pandemic unless we start to take real, meaningful action. Now, what the governor has proposed and what she's done, hiring out-of-state workers, bringing in costly traveling nurse services, and training more National Guard members, that's not the answers for our hospitals and our nursing homes. We need to give our hospitals and our facilities the flexibility they need right now. What we really need to do is we need to get out of their way and let them do the jobs that they're trained to do. I believe there's a lot we can agree to when it comes to supporting and growing our healthcare workforce. We need to come together and get it done. Our healthcare workers are overwhelmed, they're overburdened, and burned out. We need to help them and not crush them with more mandates. So going back to the headlines for a minute, this is the headline that I want to be responsible for crafting and that I know every member of our conference will be involved in making sure happens. A headline that reads, New York State ends mandates. Yes. Steps up to support our nurses and our healthcare workers and protects and provides access to timely and quality care for all New Yorkers. That's what this conference stands for.